Okay, hello everyone. Welcome to the guided newspaper practice session. We are doing this after a really long time. So, a very warm welcome to all the students who are joining in. We would just require 2 to 3 minutes. We're doing this after a long time. We're just setting it up and then we will be starting the session. We'll just wait for all the students as well to join in. If you're inside the class, just type a hello or a hi there so that I know you're in. You can also get the audio and video. Just give us a hi or a hello if you're in. We will start in a couple of minutes. Okay, hi Shivam. Hello, Ritika Deepti, Alicia, Gagandeep, KK Dylan. Wonderful. We just need 2 more minutes and then we will get started. Okay, who else do I see in the session? All right, another 30 seconds and then we will begin. 30 more seconds. Hello, Sana. Good to have you. Okay, wonderful. So let's start. All right. Yes. Hello, Mahek. Good evening. Welcome. Okay. So let's begin the session. So these sessions are called guided newspaper practice classes. In these classes, what we do is we try to give you a basic understanding of the English language. Okay. So in the IELTS test, yes, you have various advanced topics, right? You have writing, reading, listening, speaking, and all of that. But now in this class, what we'll do is we will try to take it at a more fundamental level. Okay. So we will be doing this entire article. We will take it very slow, but we'll make sure that we are learning new words. We are absorbing the language. We are understanding whatever is written. Okay. And as we move further, we will first tackle listening and reading, which means that I will read this particular passage loudly for you. I will explain the meaning of the sentences. Now, you should also, at the same time, consume the language through your ears and watch the whole lesson, kind of see the text and try to absorb. Okay. Then what we'll do is we'll take one particular paragraph and then we'll just do loud reading. Okay. When we read this loudly, English will come out of your mouth. You will get more comfort. Now, when you get topics around health, just because you have spoken English loudly in this particular context, if you get similar questions, you will be more confident. Okay. Finally, we will be taking certain new words that we learn during this session. We will try to frame sentences out of it. All right. That is going to be the agenda. Okay, so good again, good to have all of you. Let's start. All right. So this particular article is around COVID vaccine and possible side effects of it. Okay. India started the second phase of the COVID-19 vaccination drive on March 1st, 2021 for people with comorbidities and those above 60 years of age. So what do you mean by this term comorbidities? Tell me, what do you mean by this term? India started the second phase of this particular drive on March 1st for people with comorbidities. So what do you mean? Hi, Mazhar. Hi, Vikas. Good to have you. Think comorbidities. Okay. So the moment we say comorbidities, yes, it means people having two health conditions together. Okay. That's called comorbidities. So if someone gets COVID-19 and they have, say, diabetes already, okay, then these patients would be termed comorbid patients and they would get priority, okay, for a vaccine. So that's what's happening. Right. So India started this phase for people with comorbidities and those above 60 years of age. So this is the priority. Now, since there is no provision of insurance for recipients of coronavirus vaccine against any kind of side effects or medical complications that may arise due to inoculation, okay, as stated by this person, there is a need to keep track of the possible side effects that one could face, especially senior citizens and people with comorbidities. So what does this particular sentence mean exactly? A nice long sentence, right? So what does it mean really? Let's see. So it says that there is no insurance as such. All those who are getting the vaccine, there is no insurance that says that, hey, if something happens, if there is something that goes wrong, then you will be protected, okay, whether monetarily or otherwise. So there is nothing of that sort, right? There is still a lot of uncertainty. So because there is nothing like that and there is a lot of uncertainty, we should keep track. What do you mean by keep track of something? There is a need to keep track. What do you mean by this phrase? What do you think? Good. Kinjal, Kamaljeet, Aruna, good. Others? Tell me. What do you mean by keeping track of something? Yeah. So when you keep track, just keep putting it on the comment box. Okay. That's how you will keep learning. So when I say keep track, it means to be updated. Okay. To follow something very closely. Okay. Yes. To watch something closely, monitor something closely. So we should monitor any possible side effects that one could face, especially these guys, senior citizens and people with comorbidities. Very good. Observe. Very good. Good, Gagandeep. Dylan. Now, currently, so right now, India has granted emergency use authorization to two COVID-19 vaccines. One, Pune-based Serum Institute of India's Covishield and Hyderabad-based Bharat Biotech International Limited's Covaxin as part of the government's vaccination drive. Simple. Okay, so why am I using the word granted? I can also use the word given. India has given emergency use authorization. Which one do you think is a better choice? Granted or given? Which one do you think is a better choice? Think what is the situation based on which you are using this particular word. Think about it. Very nice. So when you say granted, okay, it means you are giving permission. So in that context, you will use granted. Okay, given is a very generic term. You can use given for multiple situations, right? But when it is very specific about permission, in that case, you will use the word granted. Okay. Now, good job, everyone. Okay, let us move to the next one. According to this body, according to vaccination guidelines, where this, antibodies develop 2 weeks after receiving the second dose of the COVID-19 vaccine. So, when I say antibodies, it's probably the substances that counter the virus. Okay. All right. Now, a Lancet study also found, okay, so what do you mean by Lancet? A Lancet study is a proper noun, okay, so it is a terminology, some kind of a study that is conducted, some kind of a research that is conducted, also found that a 3 month interval between the two doses of this particular vaccine should be the optimal gap between the two doses to make the process more effective and for the government to immunize a larger number of people in the time period. So, what do you mean by the term optimal? Tell me, optimal. Optimum. Have you heard of this phrase? Optimal, optimum. Good. Anmol, Gagandeep, Pranav, Monica, Kinjal. Good. Optimal. Yeah. So optimum is ideal duration. Okay. So neither too much nor too less. That is called optimal. Okay. So they found that 3 months is ideal so that more number of people can get vaccinated. Okay. Now the study further highlighted that the vaccine gives up 81% protection if vaccinated twice in between 12 weeks. Whereas participants vaccinated twice in quick succession of 6 weeks have only 55% protection against the disease. Are you able to see this? Are you able to get the meaning of this? That if the gap between the two doses is 12 weeks, then it gives you more protection. But if the gap is only 6 weeks, it gives you lesser protection. Okay, so that is the meaning of this particular sentence. Okay, you can see how nicely they are elaborating and articulating, right? In these sentences, they are conveying so many things with two data points, with numbers. They're able to tell you, convince you that if the duration is more, yes, it makes sense because the protection, degree of protection is greater. Okay, let's go further. Let us jump into what are the possible side effects. Okay, let's go into this. Let's see. We'll do this and then we'll do a speaking round. We'll just do the whole thing loudly. Okay, tiredness, fever, chills, nausea, vomiting, joint pain after getting vaccinated are common and will subside within a day or two. What is the meaning of the word subside? Subside. What is the meaning of this? Will subside. You can get all these, but they will subside within a day or two. Good. It will reduce. Okay. It will not go away completely. It will reduce to a large extent, subside. Okay. But if there are any serious symptoms, then consult your doctor on an immediate basis, explained Dr. Rani. Okay. According to him, pain and swelling may occur. So then Dr. Rane suggests something. He says, take a cool, damp cloth or wrap an ice pack on the area where vaccine is given. All right. Now, this particular word is not wrap. Okay. Usually, people have this tendency to say wrap. All right. But the W is silent. So you will simply say wrap. That's all. Take a damp cloth or wrap an ice pack on the area where the vaccine is given. If you just did this, just do this loudly and type down on the comment box, wrap an ice pack, not wrap. Okay, just give me a done. Good. Hi, Dheeraj, Vikas, Kinjal, Anki Reddy, Sana, Anmol. Very nice. Okay, let's move on. According to the World Health Organization, so according to these guys, look at what they say. Like any vaccine, COVID-19 vaccines can cause mild side effects, such as a low-grade fever or pain or redness at the injection site. Redness means a red color area, right? It can cause a red color at the injection site. Most reactions to vaccines are mild and go away within a few days on their own. More serious or long lasting side effects. Long lasting means it stays there for a greater period of time. Okay, are possible but extremely rare. So vaccines are continually monitored to detect rare adverse events. The word continually, okay, what is the difference between continually and continuously? Tell me, continually versus continuously. What do you think? Good, very nice. All those who did it, Kinjal, Aruna, good. Vaccines are continually monitored. Why can't I say vaccines are continuously monitored? What do you think is the difference here? What do you think? Okay, okay, interesting. Now, when I say continually, it means a start and stop. Okay, continuously means always doing it. Okay, so you can't monitor the vaccines real time or completely, right? You cannot do it 24 by 7. Your people will also have other work to do. Okay, continually means taking the data for today and then having a look at it, then taking the data for tomorrow, having a look at it again. So that is continually, which is a more realistic, apt term. So you will say that I'm continually studying for IELTS. You will not say I'm continuously studying for IELTS, which means that if you say I'm continuously studying for the past 3 months, it means you've not slept, you've not eaten, you're only studying the full time, which is obviously not practical, right? You have been continually studying, which means you're studying, which is your main job, and then maybe you're eating, you're sleeping, you're doing some other work, but then again, you're coming back to your books. Okay, so that is a more realistic, apt term. Okay, got it? Just give me a yes on the box if you understood this. Let's move. It adds that reported side effects to COVID-19 vaccines have mostly been mild to moderate and short lasting. Long lasting, short lasting, they end soon. They include, so what kind of side effects are they? Fever, fatigue. What do you mean by the word fatigue? Tell me. And then I'll tell you fever, fatigue, headache, muscle pain, chills, diarrhea, and pain at the injection site. Okay, the chances of any of these side effects following vaccination differ according to the specific COVID-19 vaccine. Okay, so based on these variants, some side effects might vary here and there. Okay, very good, good. Mazhar, Ankireddy, Kamaljeet, very nice, very nice. All right. Okay, so now what we are going to do is you got an understanding. So fatigue means tiredness. Okay, you're very tired of doing something. It's called fatigue. You have done the same thing over and over again. Fatigue sets in. Okay, tiredness comes in. Okay, wonderful. Okay, so now what we are going to do is we are going to jump into a speaking exercise. Okay, so how are we going to do it? I'm going to give you one particular paragraph, okay, or maybe we'll do even two, and you will have to read it loudly with me. Okay, the aim here is to make sure you get your pronunciation right and you're able to stop at the right places. So wherever you have punctuation marks, we will stop. We will try to express ourselves properly. Okay, that is going to be the aim. Okay, good. Let's do it. So I will be reading, say, 2 to 3 words at a time, and then I will pause. You have to repeat after me. Okay, English has to come out of your mouth. The more English comes out, the more comfort you will feel. It's okay if you, even if you're not speaking to somebody else, you just do it alone with yourself. You will develop more confidence, and that is why we are doing this whole exercise. Okay, to improve our basics, to improve our fundamental elements. Okay, let's begin. Is there a link between the vaccine and allergic reactions? Okay, let's start. According to WHO, repeat loudly. According to WHO, a severe allergic reaction, such as anaphylaxis, medical term, don't worry, anaphylaxis is a potential but rare side effect with any vaccine. We have hit a full stop, our voice will go down. Okay, next. In persons with a known risk, comma, so we stop. In persons with a known risk, such as previous experience of an allergic reaction to a previous dose of the vaccine, or any of the known components in the vaccine repeat, precautions may need to be taken. Voice down at the end. Precautions may need to be taken. Okay, voice dipping down at the end always. WHO recommends that healthcare providers, loudly, assess patient medical history to determine if a patient is at risk for severe allergic reaction to a COVID-19 vaccine. Yes, all of you doing it with me? Just give me a quick yes on the comment box if you're doing it with me and you're feeling comfortable, you're feeling okay, and there are no side effects of this session. Okay, all right. Let's keep going. All immunization providers, so all those who are giving the vaccine, all immunization providers should be trained to recognize severe allergic reactions, okay, and take practical steps to treat such reactions if they occur. Okay. Nice. Good. Pranav, Kamaljeet. Very good. No. One more paragraph, and then we will go into sentence building. Okay. Something that all of you like. Okay. Good. Kinjal. Should you take a painkiller after the jab? Okay. After the jab, should you take a painkiller? Good. Anki Reddy. As per the Centers of Disease Control and Prevention and Indian Medical Boards, so all terminologies, don't worry. As per these people, using light medication, you can focus on certain words. Using light medication like paracetamol or acetaminophen drugs is all right. Okay. However, so whenever you have this word, you know there is a twist coming in. Okay. So, however, as per experts, consult a physician before taking any painkiller to get relief from the unpleasant side effects. Now, if taken preemptively, very good word here, preempt, okay, which means that you're predicting that something will happen and then you're taking measures to cut that down. That is called preemptive, preempt, okay. So for instance, if you say that, hey, I know that I will face problems in reading, okay, so you have improved on your reading speed, for example. So you have preempted your weakness and you have worked on it, okay, you're doing something in advance. So if taken preemptively, now if you take painkillers like that, thinking, hey, it will hurt, so let me take a painkiller today, then painkillers could interfere with the vaccine and make it ineffective. Are you understanding what's happening here? That if painkillers are taken preemptively, that you're thinking that, hey, it will pain, so let me take a painkiller right now, it might interfere with the vaccine and make it ineffective. Okay, so the very purpose is defeated. All right, that's what it means. Okay, wonderful, wonderful. All of you done? Just give me a quick done if you finish the whole thing. Okay, so now what we are going to do is we are going to move on and do sentence building. So we are going to now create sentences out of certain words that we learned, okay, before we close. All right, so the first word for you today is a different word. Let us take the word inoculation. What do you mean by the word inoculation? Okay, all those who are new, who are watching this session for the very first time, do subscribe to the channel so that you get these, get the alerts of these sessions. We plan to do more of it so that your basics of the language improve. Do like the video, comment all the assignments, mini assignments that are coming your way. Okay, like these sentence building, meaning of these words. So you will find the class more enjoyable when you participate. Very good. Good, Pranav, Kamaljeet, all those on the live chat box. Very good. Inoculation basically means vaccination. Okay, just a nice fancy term for it. Okay, so you might find some places mentioning themselves as inoculation centers instead of vaccination centers, inoculation centers. Okay, if I ask you, when are you getting inoculated? It means when are you getting vaccinated? Just a fancy way of saying it. Okay, so I will give you about 30 to 45 seconds. Frame a sentence with inoculation, inoculated, any forms. There are 5 inoculation centers in my city, for example. Okay, senior citizens are getting priority for getting inoculated. Good, Anmol. Good attempt. Good, Anki Reddy. Others. Think. And this passage is from Indian Express. Very good newspaper. Very nice language. You can do more of it. Okay, so if you're liking this approach, open the newspaper, do more of it yourself as well. Okay, time up. Ready with your sentences. 5 more seconds. All right. Okay, so that was inoculation. Okay, simple meaning, fancy word. Okay, next. Next, let us use optimal. Okay, optimal. So optimal is neither too less nor too much, the perfect combination. Okay, that is called optimal. For example, watching television for 1 hour a day is optimal or optimum. Okay, both are okay. It means that is the best point. Too much of it, and I might get a headache. If I don't watch television at all, then I might get bored. Okay, so for a little bit of entertainment, I think 1 hour is optimum. 1 hour is optimal. Okay, the perfect balance condition. That is called optimal. Very nice. Good sentences. Kinjal, Pranav, Dylan, Pama. Very nice. Starting. So if I have to correct some of you, I got my first inoculation. Okay, or you can say I got inoculated in. Pranav, a inoculation awareness and inoculation awareness. Dylan, most of the people are ready for inoculation. Good, Dylan, perfect. Pama, Indian government start first phase to starting inoculated to start inoculation. Pama, whenever you put to plus verb, always use the simple form to start inoculation. That's all. Okay. Okay with optimal. 30 more seconds for optimal. So whenever you're using the word optimal, optimum, remember that it should be somewhere in the middle. Okay, too much of it should be bad. Too less of it should also be bad. Okay, so that's where you will use optimal. Could like say Dylan says, 1 apple a day is optimal for health. Too much of it and it'll give you a stomach upset. If you don't eat it at all, then you're losing out on those nutrients. Okay. Good. Ishita, children should be permitted to watch mobiles on optimal basis. Good, Ishita. Works. Pranav, I am optimal at age of 6. Not very clear. Maybe you can try out a different sentence. Make optimal use of water. Okay, Kamaljeet, works. Good job. Okay, good. Okay, let's do one more. Let's do one more interesting word. Let us take. Let us take this word, subside. Subside. So anything that is unpleasant going down is called subside. Anything that is unpleasant. Okay. It should be something that makes you uncomfortable. For example, you can say that the storm subsided. That is okay because it is something unpleasant, right? It is dangerous. So you can use the word subside. The fever subsided, something unpleasant going down. Okay. But you cannot say my happiness subsided. Okay. Something subsiding, fever subsiding, my headache subsided as soon as I took the tablet. Okay. Okay, so now optimum utilization of resources, where optimum means maximum, no. Here again, it will be optimum means ideal. So if you use too much of it, then you will not have it for the future, right? But and if you use too less, then you will not have anything for today. Okay, so optimum means you're using it, but enough of it. Like say electricity, use electricity optimally, which means that you will not waste everything right now, nor will you always keep everything off as well. Okay, good. Anjali Bajaj, the solution contains very good. Anki Reddy, good. Some of you giving good sentences. Good job. Is it a hectic schedule? Make people subsided. It is saying make people reduced. Doesn't really convey your point clearly, but good attempt. Okay. All of you are being very bold and you're trying it out even if you're not getting it. So this is the best approach. Okay. Just try out, keep doing it. There is no ideal situation to practice. You just have to keep doing it to get better. Okay. Kinjal, my pain subsided. Very good, Kinjal. Daily reading of newspaper helps to subside hesitation to read. Very good, Dylan. Nice. Works. There you go. Okay. Great job. Great job done, everyone. Okay, wonderful. That brings us kind of to the end of this session. I'm really happy that many of you joined today and we could revive this series. We will do more of it. Okay, we'll try to do at least 2-3 per week live like this on YouTube so that you can all join in and we can work on the basics. Okay, so new students, do like the video, do give us a comment on how you liked it, whether you would like something new here. Okay, love the feedback, anything that you have to say. Do subscribe to the channel so that you can keep getting the alerts. All right. Many of you I also see here are our advanced program members too, which is our fast track program. Other students who would like to be part of it, if you want to get into a more intense IELTS training program, this is the program that I'm talking about. Okay. So some of you might have filled up the form and all of it. My approach is just fill up this form again if you are in this class so that our counselor will prioritize your call and then we'll explain this program to you. Okay, now this is a very detailed IELTS training program. So number one, you have a recorded lesson. So there are 125 plus recorded lessons on our app, and these videos will also play on your laptop as well, covering listening, reading, writing, speaking, grammar, vocab, pronunciation. So wonderful for complete learning. So if you're very busy or you're working in the medical field, for example, you have changing shifts, all of that, this will give you a complete structured approach. We cover all essay types, all question types, and so on. But apart from this, we will also have live classes happening. So live classes happen daily, 7:30 to 8:30 p.m. on the weekdays, 8 to 10 p.m. on the weekend. So the reason why we do this, why we do live classes apart from recorded classes, is that there is some kind of habit forming, right? You come to the class, you see what's going on, you also participate, so you feel like studying, and then you will do more of it. So many of you I know will now try to do reading on your own as well. Okay, so that is why we do live classes. 1 week per section is how we go. Then we will have reviews as well. So there will be 10 full-length mock tests, and each of these mock tests will be evaluated in detail. You will get a full report of where you're going wrong, how to improve, and you will have unlimited doubt support as well. Okay, so all of this will be valid for the next 90 days, although anyone having more than 3 weeks can enroll. So many of the students have about 45 to 60 days target, but the validity is all the way up to 90 days. Okay, so if you want to know a little bit more, you have to fill this particular form, the link of which is given here. So just fill up your name, mobile number. If you're from outside India, put in your country code and which exam, academic or GT, and how much time you have. Okay, so once you're done filling it up, our counselor will give you a call. We'll explain the program to you, and then you can get inside. All right, so that's the program. Thank you everyone for joining in. It was absolutely wonderful to be hosting this session. I'll see you again very soon. Until then, keep studying. Bye-bye. Take care.